So again, just to review, I was talking about with your first aid protocols, you always want to run through your primary and your secondary survey. So in this case, we can say the primary survey is done because we know that our patient has an airway, they're breathing, and has circulation. So because we're concerned that our person isn't quite acting right or they don't seem like their typical self when they come in, we want to run through our secondary survey to see possibly what's wrong with them. So if you remember, you can do a secondary survey with either doing a hands-on head-to-toe check, or you can also do it with a hands-off by asking them to do things for you. So again, if you think about that mnemonic FAST that we talked about, it'll give us a good idea as to what's going on with the person. So my friend's going to help me out to demonstrate this, and I'm going to get her to pretty much act the way that my friend did that I talked about in the blog post story. So, Helen, what happened on the weekend?
I don't remember.
Okay, do you remember like what you had for breakfast this morning?
I don't know.
No? Okay. Can you do me a favor? Can you lift your arms up over your head for me? Okay, did you get both of them up?
Yeah.
Okay, can you kick your legs out towards me for me? Okay. So in this case, if you remember the face, arm, speech, time, her arm and one side is not working properly. So that's a really good indication to us that she's had a stroke or there's something else going on. So now that we know there's an issue, we want to call 911 and have them come and take Helen to the hospital and take care of her. But in the meantime, we also need to monitor her ABCs and make sure that she's taken care of. And when somebody's had a stroke, we want to get them into the most comfortable position possible. So in this case, if she's not totally comfortable sitting up like that, then we want to get her laid down on the bed. And we want to make sure that the unaffected side is the side that's down. Because if she's going to be in that position for any length of time, there can be issues with pressure sores and different things like that, especially once the ambulance comes to get her. The other thing too is to make sure the unaffected side is down so that she's got motor control with her mouth. So if for some reason she was to throw up or anything like that, she's got motor control to be able to get anything from her mouth out, and it maintains that airway and breathing for her. So she's going to have a tough time laying down, so we're going to have to chip in to help her to do it. So Helen, we're just going to lay you down on the bed, okay? So if I can get you to support yourself with this arm, we're going to lay you down this way. Okay, so when you're ready, I'm going to help you with your legs in order to lay you down. So go ahead and take your position. Okay, so the other thing is that it's going to be more comfortable for her to have her head up like that, and then we support her head like this. And that way we can stay monitoring her until the ambulance gets here, and we can stay talking to her to make sure that she's okay and that she's breathing and taken care of.